friends! So in this video, we're going to go over the works and activities essays for the medical school application. What are they and how do we write them? The works and activities are one of the major types of essays that you will complete when filling out your application for medical school. They describe what kinds of activities you've done and what sorts of things you've accomplished since graduating high school and what you learned from those experiences. So again, on AMCAS, the MD or allopathic medical school application, you get 15 slots and 700 characters for each of those slots. And then 3 of those slots can be designated as most meaningful experiences, where you get an additional 1325 characters. Note that these are separate text boxes. So don't begin one sentence in the 700 character blurb and then finish it in the 1325 character blurb. There are 19 categories that you can choose from: clinical volunteering, non-clinical volunteering, physician shadowing, leadership, clinical employment, non-clinical employment, artistic endeavors, hobbies, intercollegiate athletics, research and lab experiences, publications, presentations or posters, conferences attended, extracurricular activities, teaching, tutoring, teaching assistantship positions, social justice and advocacy, which was just added in 2023, military service, honors, awards, and recognitions, and other. Note that since there are 19 categories that you can choose from and only 15 slots, you obviously don't need to hit every category, and that is 100% not expected of you to do so. On AACOMAS, on the other hand, the DO or osteopathic application, we have unlimited slots, but you get 600 characters instead of 700 characters. And the types of activities fall into 2 major categories of either experiences or achievements. Experiences either being non-healthcare employment, extracurricular activities, non-healthcare volunteer or community enrichment, or healthcare experiences. And achievements being awards, honors, presentations, publications, or scholarships. Appropriately categorizing your activities can be super important, especially if there's a high-yield category where you might be low on hours and need to make sure you escape being screened out. So real quick, what did I mean by a high-yield category? This is the data from the matriculation questionnaire for the cycles of 2020, 2021, and 2022 from AMCAS, or the MD application. So of the people who matriculated to MD schools, almost 95% have shadowing of some kind, around 90% have volunteered in a healthcare field, around 90% have volunteered in a non-healthcare field, and around 55% have worked in research. I really want to highlight, though, that this particular table doesn't include types of paid employment, where the healthcare experience percentage and the research experience percentage as a whole would almost certainly increase. Second major question: what did I mean by being screened out? I think it's important to note that when I say being screened out, I mean by like a computer-based screening function, just to get to a pair of human eyeballs, and not the screening to get an interview. So from an inside scoop from some admissions committee members from the school where I'm admitted, and some conversations between admissions committee members and NIH PreMed advisors that they relay back to us, schools may not come outright and say it, but they do use screening and filter functions when they comb through candidates. It's not uncommon for admissions committee members to use search criteria and filtering criteria to decrease the workload of the members who actually review the application by hand. In order to fill a class with a certain degree of variation in profiles and experiences, they'll sort the applications based on different criteria. So say they want maybe 20% of the class to have strong research backgrounds. They might set the search function to sort by hours in research, publications, or posters listed. Say they want at least 40% of the class to have strong degrees of community service. They might sort by community service hours and filter out those with too few hours listed. It's most certainly possible to still get to a pair of human eyes or even get an interview without meeting some of these minimum thresholds, but it's significantly less likely unless you were exceptional in another area that they were searching or sorting for. These are numbers reported by the NIH PreMed advisors based on their conversations with admissions committee members. Generally, some screening criteria used to prioritize applicants with stronger experiences are 100 hours of clinical experience, 100 hours of non-clinical volunteering experience, some amount of shadowing that demonstrates continued interest in gaining exposure and insight into what a physician's job really entails. It should be noted, though, that if your clinical hours are high, either in paid employment or in volunteering, especially if you were a scribe, you can probably get away with fewer hours of shadowing. And we mentioned before that research is becoming a bit of a soft requirement. But how much is enough? You should have enough involvement in research to understand what question you're asking, how you're investigating that question, how you're measuring the results, and what conclusions you can safely come to. A brief note: on the last slide were the hours needed to just avoid getting screened out. Generally, successful applicants will have hours in at least one or two of the major categories that greatly exceed the screening numbers. After those minimum numbers of hours are met, there is something to be said about valuing quality over quantity. However, it's worth noting that quality experiences, interactions, contributions, or anything worth really writing about are super highly correlated with quantities of hours. So, how do we write the works and activities essays? Some strategies and tips for compiling your works and activities, selecting which to include and which to exclude, and deciding which to make most meaningful experiences. You should note that there are 15 slots and 15 core competencies. This is not an accident. You can use one activity to demonstrate more than one competency, but ideally, each competency is touched upon at least once since you undeniably have the space to do so. Strong applicants will have at least around 10 works and activities. I note this not to discourage anyone so much as to emphasize that this is one of the major places where you get to show off what you've done throughout your post-secondary career up until this point. A lot of people don't remember everything that they did or list everything that they can in their first pass, but literally anything and everything after high school can and often should be listed here. It also tends to be recommended to have no more than 3 experiences in any singular category for a couple of reasons. 1, you want to show breadth and diversity in your experiences. 2, if more than 1 to 2 activities wind up having a lot of overlap in roles, responsibilities, and accomplishments, repeating yourself in the descriptions can dilute the impacts that you had and come off as a little bit space-filling or fluff entries. Also, it's worth remembering that given that you're applying to become a physician, ideally, at least one of these most meaningful experiences is a clinical experience. Some other things to note as you're compiling your list: anticipated activities are a thing and absolutely should be included. This includes both activities that you have already started and plan on continuing throughout the application year. This will get lumped into the same entry as the hours noted as already completed, as well as activities you plan on completing sometime throughout the application year but have not completed hours in yet. By the nature of the fact that you haven't completed those hours yet and could potentially flake, they won't be weighed quite as heavily as the activities you've already completed. For that reason, I'd advise that if you're listing clinical hours through your anticipated activities, this should not be the bulk of where your clinical hours come from, unless you have super sufficient hours listed elsewhere. I also want to note that hobbies are also a thing, and they should be included. They show that you're human, have a life and passions outside of medicine, and therefore, theoretically, have ways of keeping yourself sane and balanced. Though for the same reasons as not wanting to come off as space-filling or fluff entries, I wouldn't list more than 1 or 2 hobbies. Each activity is going to require the categorization or type of experience, the name of the experience, a contact, so the name and title that they held in the organization, an email and phone number for this contact, the organization itself, and the location of the organization. It's also going to require the date ranges during which you did the activity, as well as the hours completed. Some general strategies that I want to note: you emphasize by proportionality. What people take away from your experiences are going to depend on what you lead off with and what you gave the most space to. For those reasons, it's generally preferable to dedicate more space to things like the impacts or direct contributions you made, the stories that stood out to you while you served in that capacity, the reflections that you have from that experience on how you grew, what you learned about what gives you purpose, or maybe how this reaffirmed your desire to be a physician or what kind of physician you want to be. Don't write this like a job listing where the description needs every responsibility and role and task that you did listed like you would on a resume or CV. I also want to note that you have a decent bit of space in the title. You can save some characters for things like reflections and stories by listing the specifics like the name of the hospital or the job description that you had in the title of the activity. This is just an example format that I used pretty frequently based on a combination of the lessons that resonated with me from my special master's program, the NIH PreMed advisors, and what I learned from watching way too many hours of Dr. Ryan Gray's videos. The first 1/2 to 1 sentence give just enough context to understand the setting. You can expand upon this if this is not something someone would be well acquainted with. So if you worked in a less well understood job, or were in the military and the roles that you had while serving are not something that a layperson would immediately infer from the title. You can reduce this if this is a super commonly understood position. So, waiting tables, teaching assistant positions, nurse aide positions, etc. In the next 2 to 3 sentences, tell us something impactful. For leadership positions, how many people were on the team that you managed? Did you raise money? How much? Did you organize events? How many people turned up? Did that involve raising money? How much did you raise and in what time frame? And what was that money used for? For volunteering or teaching positions, maybe tell a story where you demonstrate a core competency. Maybe you worked with a student who forced you to learn new ways of effectively communicating with them. Maybe you worked with a patient who reminded you of a family member, and that informed the way that you approached them. And then on the last 1 to 2 sentences, or really however much space you have left, give a solid reflection on maybe how you grew from this experience, or how this reaffirmed your journey, or what you learned about working with others of various demographics. One major exception to that format is shadowing. Shadowing can easily be condensed into one activity, where you list all the physicians by name in the facilities, departments, specialties, and etc. that you shadowed. If some hours were virtual, note which ones were virtual and which ones were in person. So here's one example from my application to show this formula in action. Gray is the context. Yellow, I tell a story about meeting a group of women in the nursing home I was training in, and how we bonded over their shock at my baking-free childhood, and how they wanted to teach me to bake, and how that was a tidbit that they never forgot about me, in spite of some of them having dementia. And then in pink is a short reflection. In this one, I use the last few characters to preemptively head off a potential source of skepticism, since you might have noticed that this is just my training, so I only list about 120 hours, and I wanted to make it clear that the only reason I didn't work afterwards as a nurse aide was because of a shoulder injury. I think it's worth highlighting that while I'm trying to head off some skepticism, I'm not writing defensively so much as stating a fact. This is another example. This is 2 activities merged into one slot, so there's a little more gray for context. Since I had a little less space for yellow or something impactful, and still wanted enough space for pink, the reflection, I kept it more focused on what I learned regarding the physician's dynamic with the patients and their loved ones. This is an example of a non-clinical volunteering and non-most meaningful experience. Again, I just want to note the proportions of the colors. There's minimal gray for context. It's mostly yellow, elaborating on who my kiddo was, where she was coming from, the challenges that her background presented to me as an educator, and the concrete and tangible steps that I took to try and work with her. And then that last sentence of pink, reflecting on how seeing her grow fostered growth in me too. Note that you don't have to use every reflection to tie it directly back into medicine. Sometimes it's good to just comment on how it impacted your personal growth and development of certain traits. Traits that happen to also be beneficial for physicians, but you don't have to come out right and say it. This last non-most meaningful experience is a leadership one. In this one, there wasn't enough space for a reflection in addition to all the yellow things that I wanted to add on the tangible ways in which we contributed as a group. So I erred on the side of letting the accomplishments speak for themselves here. My point being that this formula is flexible. Give space to the elements that you think will strengthen your case the most. A lot like listing awards and publications, where listing all of the things requires more space, a reflection may not be necessary, since then your work kind of speaks for itself. And this is what I mean by shadowing being an exception to the formula. Here, I literally just list all of the shadowing that I did that wasn't listed elsewhere and crammed them all into one activity for both in-person and virtual. Some examples of most meaningful experiences. This is a research most meaningful experience. I want to point out that it has all the elements that we talked about, but they're reordered because I didn't have enough space for the impactful things in the 700 character blurb, and I also wanted to vary things up a bit. So while I'm using the formula, it doesn't look quite so obviously formulaic. So we see I use the gray to detail where I am and what I do. In pink, I talk about seeing the interplay between research and the treatment of this rare disease. And in yellow, I detail everything that I accomplished during my time at the NIH. This is another most meaningful experience. I want to note you can and also should use the most meaningful experiences remarks to give space to whatever will strengthen your case the most. So in the research most meaningful experience on the last slide, the tangible things that I was doing or completed were enough that they kind of spoke for themselves. So I gave the most space to the yellow, something impactful things. Whereas here, this job is both less traditional and a little less impressive at the surface value. So I elaborated mostly on my reflections on the translatable life skills that I learned in this position. Next up, we'll be covering the personal statement. What is it? What is its purpose? And how do we write it? So I hope you enjoyed this video. If you liked it, please subscribe and hit the thumbs up button, and I hope to see you in the next video.